Hi there, this is Dr. Brad Makimaa with Southernmost Foot Ankle Specialists and UrgentFootCare.com. Today we're going to talk about Sever's disease. Sever's, S-E-V-E-R-S, Sever's disease. It's not a disease. It is an inflammation of a growth plate discussed by Dr. Sever. Anyway, it's in kids, mainly 10 to 13 age group, very active, and hurts in the back of the heel. Very, very common. Let's look at some anatomy and talk about what's involved with Sever's disease. We've taken some x-rays. We'll look at yours shortly. First, understanding what is a growth plate, what does it look like? Here's a growth plate. This is a 10-year-old. Right here's the growth plate. And the Achilles tendon comes down and attaches to the growth plate. If you look over here, you can see the Achilles tendon coming attaching to, well, what would be adult bone, and that would be solid in an adult. However, in a child, you've got a growth plate, and that's this open space where this is all going to continue to grow bone. If I jump over to here again, this was a 10-year-old, and this is a 13-year-old. Still a growth plate present, still not solid adult bone, still vulnerable. Both of these children had inflammation of the growth plate and pain from the Achilles pulling and pulling, not on the whole heel bone, but the Achilles is pulling on the growth plate. So you have basically what happens, a lot of sports and activities start getting adult level speed and practices, yet you still have a little kid growth plate where the Achilles is trying to pull on this little piece rather than the entire heel bone itself. So that's the anatomy of what's happening. Typically, this can go from case to case, but typically is going to need 4 weeks, no activity, no running, no jumping. We need this inflammation and this growth plate to heal. I mean, this is where the bone grows from, and we really need that to heal up properly. We want to look at flexibility. We want to look at how much dorsiflexion or flexibility there is of the foot in this direction here, and flexibility of the Achilles. What we'll add are heel cups made of silicone, which will then raise the heel higher. So even if there isn't enough flexibility, we cheat, so to speak, and gain a little range of motion by adding the heel cup, and also a shoe with an elevated heel. Bad part for the parents is with the heel cup and an elevated heel in the shoe, your child may feel better within a day or two and say, hey, why am I not out to play? It's because we're still trying to heal this up properly. So elevating the heel and stretching. Stretch, 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 because if you go back and play the same sport and we haven't changed anything, it's going to come back again. Also, the next growth spurt, the bones are going to grow and elongate. They're going to leave the Achilles tendon behind. In the next growth spurt, we may go through this again. So the stretching is critical. We do have some stretching handouts for you. A lot of them are going to be involved with this type of a stretch, putting your foot elevated in this position, leaning into it, or the front step of the house, you walk in, hang your heels off the step. You want to find all those spots that for your child, you can say, hey, when you walk in, hang off here. If you have a cell phone, you're talking on the phone, I want you to stand like this. If you're brushing your teeth in the morning, you put your foot here. These type of things, so it's not a constant, hey, did you do your stretching? But you found those spots around the house where you can do the stretching constantly. Hey, you want to have a snack beforehand? I want to see a stretch. Just so there's that habit that forms, because this may take years to improve. Lastly is a night splint. This is a splint in which going to be on top of the foot and ankle, just like this. We'll demonstrate and show you how to put this in, but basically a big strap here, straps here on the bottom, and just slides right in. This can be watching TV, reading, doing homework, video game, whatever the case may be, and hold the foot at that 90-degree angle like this. Or when sleeping also, so you can wake up functional, ready to go. It's a passive stretch in addition to the dynamic stretching that we're talking about. Usually we'll follow you back in 4 weeks, make sure everything's good, no pain, and improve flexibility, and right back to sports, no problem. Sever's disease. I hope yours is better soon. Thank you.